Welcome to Plain Talk Politics. I'm Jeanne Bonds. This is plain talk about the people, the process, and the facts so you can make an informed decision. My guest today is Representative David Lewis of the North Carolina General Assembly. Welcome, David. Welcome to Plain Talk.
Thank you. I'm very glad to be here.
Now, David, what district do you represent? What counties do you represent?
I represent the 53rd House District, which is comprised entirely in the great county of Harnett.
And how long have you served in the legislature?
This is my 6th term, my 11th year.
Okay. And so this past session, let's just start with a little bit of reflection on what happened in the session. What would you say major accomplishments of this General Assembly?
I'm very proud of this General Assembly. We spearheaded several important reform efforts. Obviously, we came to town with the intent that we wanted to make North Carolina's economy better. We wanted to help those people who want to get jobs to be able to have good jobs to get. We sought to do that by trying to reform our tax code to make it more business friendly and also let people keep more of what they make. We did a major reform of some regulatory issues. We kept in mind that, obviously we want to keep folks safe and we want clean water and we want clean air. But some of the rules that we had we felt were repetitive or redundant, and we tried to clear that up. There was a major election law reform that we passed that we think will guarantee every person who is eligible to vote has the opportunity to vote, and that those votes cumulatively decide who wins elections. We think it'll put more integrity into the system. So all in all, I am very proud of the work that we've done.
Well, let's talk about that election law a little bit,
Sure.
because that was huge, drastic. You actually chaired a committee. You slowed it down at one point, had some public hearings on it. So the main topics being discussed with that election law, besides the identification part, there's a lot of other provisions that affect when people vote, how they can vote, some of the campaign finance details. So tell me a little bit about what that law does.
Well, the law began in the House, obviously, as a safeguard to make sure that people present a photo ID when they go to vote. If you say you are there to vote, you just be able to show and prove that you are who you say you are, and cast your vote. There were some additional provisions that were added to the bill that we think, frankly, bring North Carolina very much in line with the rest of the nation. You hear talk about early voting. Well, let me be clear. We know how important early voting is. Half the people use early voting. We want people to have access to it. In most states, the average early voting time is 8 days. There are 10 now in North Carolina, and the same number of hours available for early voting as have been in the past. What I tell folks is, yes, there are fewer days, but by extending the number of hours or the number of poll sites that will be open, perhaps the working family that gets up early in the morning, get the kids ready for school and darts off to their job or one of their jobs and works hard and then doesn't get back home till 5 or 6 o'clock at night. Maybe now they'll have the chance to use early voting as well. But all in all, the vast majority of the reforms that were in that bill really just put North Carolina law more in step with the other 49 states.
Well, there have been a couple of polls out. So High Point University ran a poll, Elon ran a poll,
Right.
and it said, that people agreed with you. On the identification part, the numbers were 70%. People,
Right.
Found that logical and reasonable. But on some of the other provisions, people really took issue. They believe that the number of days, not hours, but the number of days available for them to early vote has been cut. And they also tended to be upset about the youth vote, where 16 and 17-year-olds could register to vote early. That piece of it's been changed. Can you speak to those particular provisions?
Yes, I'm sure that when the people get ready to vote again, they'll find, I know in my own county, there's always a rush. Who's going to be the first one to get to vote during early voting? And it is an exciting time. Well, that first day of early voting, or those first few days where we have that grand influx of people, they will still be there. There's always been a little bit of a drop off in the middle of the early voting time. So we've just shortened or lessened the middle time that was used by fewer people anyway. Again, just to reiterate, the same number of hours, the same opportunities for people to vote are still going to be there in place. In terms of eliminating the 16 and 17-year-old pre-registration at school, it really was just a logistical and administrative problem that we didn't see led to any greater participation. Obviously, folks can still register to vote, and we hope they will when they turn 18. In fact, they can register and vote when they are 17 if they will be 18 by the time November rolls around. In other words, 17-year-olds can still register to vote if they're going to be 18 in time for the November general election. They would be able to participate in the primary. So making one less thing that the schools have to do, I don't think there's a great deal of pushback or consternation about that.
Well, there is about the IDs for the college student. So in the House side where you were, your committee, when the
Right.
bill came out, allowed student IDs from
Right.
public universities
Right.
and colleges. When it went over to the Senate and came back, that piece was stripped out.
Well, we actually felt that that was a little bit redundant anyway. The reason being, most of the public universities, and I don't tell you that I called them all because I didn't, but I know that we either called or visited the website of most of the major public universities, and they all require a photo ID in order to be issued a student ID. So our thought was it was a redundancy. We didn't really see the harm in it in the House, as we thought it was a redundant provision. However, there is a body of law in North Carolina that says if you're going to be in our state and you're going to live in our state, which is the requirement in order to vote, you have to live here, that you can only be in the state for 90 days before you get your North Carolina driver's license. In other words, your out-of-state driver's license would need to be changed to North Carolina. Colleges start in August. 90 days would elapse well before the November election. Bottom line, any student that is eligible to vote can still register to vote, and if for some reason they do not have the proper photo ID in order to vote at the time that it is required, which is still 3 years away, we will provide one to them at no direct cost to the individual.
And what kind of provisions are in place to help the elderly that may not have an ID? And were there changes to absentee voting?
The rules are still being written. There were some provisions put in to try to help the elderly. If you have a valid ID at the time you turn 70 and the ID subsequently expires, you don't need to worry about renewing it. And I apologize, I missed the last.
Oh, and then just asking about what other provisions may be helping those elderly, like with DMV, access to DMV to get the free IDs, that type of.
Well, we are definitely still in the process of writing the rules. It takes the Board of Election and the Division of Motor Vehicles, and of course, with oversight from the General Assembly to make sure that that gets done. But again, we are absolutely committed to make sure that the people have what they need to have in order to get a photo ID and fully exercise their rights to vote.
Let me ask you about one other provision that's kind of a general election provision that I think came from the Senate bill, which is lessening the standards on campaign ads, the stand by your ad piece where you have to talk about, you have to say, I've endorsed
Right.
this ad, I've approved of this ad. Why lessen that?
The logic behind it was that you were mandating that a certain percentage of airtime, which someone bought and paid for, be given in compliance with this rule. It was believed and it was understood that there are various federal rules that apply to many and almost all of the campaign ads, and those would still be in effect, obviously. And so we just didn't see the harm in removing what we considered a redundant provision to dedicate 3 seconds of a 30-second ad, which is 10%, to give that in that silly little, I'm so-and-so and I paid for this ad.
Okay, but North Carolina was a national model because we sort of stepped out in front and had that, and it lessened the attack ads. So how would you respond to critics who say, for years now, we've had these ads, we haven't had as many attack ads as we had prior to that provision. So with this going away, are we going to see more attack ads?
Well, Jeannie, I'm really glad you asked that. I would disagree with you that there are less attack ads. I think that now the rise of the super PACs and the rise of these outside independent expenditure groups are really the driving force behind most of that now. The candidates and the political parties, frankly, are at a significant disadvantage in trying to communicate their own messages in this sea of independent expenditure money that's there. And so I don't think there's going to be any reduction or increase in the amount of negative ads. I think that negative ads unfortunately work, and people have figured out that they work. And there are so many different campaign funding mechanisms that are out there now that people that want to say something are going to figure out a way to say it.
And let's remind our viewers when the provisions for the identification go into effect.
Right. When a voter goes to vote in 2014, they're going to be asked for their ID, but if they don't have one, they'll still be allowed to vote. No problem. There'll be an opportunity right there to sign up to say, hey, I don't have an ID, please help me get one. There'll be an ongoing active outreach to say, if you need an ID, let us know. Because by the election in 2016, which again is 3 years away, we are going to require that you either have an ID when you vote in person.
Okay, let's switch gears a little bit because the news lately has been about the Department of Health and Human Services, which is a huge department,
Yes.
18,000 employees,
Right.
very large budget, especially if you think about the federal funds that come in along with the state funds. Been a series of issues with that department. Certainly as a legislator, you're on a committee that looks at that. There's going to be an oversight hearing or meeting on October 8th coming up to take a look at that. What are your concerns as a legislature about what you're reading and hearing about DHHS?
It's very important to make the point that DHHS has not just recently begun to struggle, that it has been an agency that has been challenged with management issues for a long time. I think that during the current administration, there have been valiant efforts made to try to bring some reform and bring some order to just a massive state department. And at the same time that you're bringing in new leadership, new staff, we've also got this new computer system that has been worked on for 6 or 8 years and was supposed to make things easier, when in fact it just didn't. It just hasn't. It has in large part caused a lot of consternation among various providers of health care, but also just those consumers that rely on the state to do what it needs to do in order for them to eat I mean,
Right.
I understand. We understand. The legislature certainly understands that people just expect things to work, and we expect things to work. And right now, there are problems, and things aren't working quite right. I am optimistic that at some point in the near future, with the level of expertise and the level of devotion and time that are being put, that we will see at least these repeated problems, like providers not being paid in a timely fashion and whatnot. We will see that fixed. On the whole, I think maybe DHHS has reached a point where, in order to better meet its mission, we should look at dividing the responsibilities. I think with the amount of money and the amount of responsibility and trust that the taxpayers have, that their money is being spent wisely, perhaps the Medicaid administration portion should become its own cabinet level agency that reports directly to the governor. And then the health part of the mission could still be carried out by the health agency. You know, folks forget that that's how it used to be.
Right.
And that agency was consolidated some years back. It wasn't a unanimous vote in the General Assembly to do that. And I think maybe the time has come. What is missing from the equation, I think, is the understanding of just how complicated this is. There's a certain amount of state money, a certain amount of federal money. All this stuff flows in. There are various requirements that have to be met. There are checks and balances that are supposed to make sure that the state money only flows to the providers that are doing what they're supposed to do. Sometimes even that system doesn't work. The computer is flagged wrongly. I can tell you that we have responded, and I know that my colleagues on both sides of the aisle have responded to numerous calls and emails and letters and personal visits from folks saying, hey, you know, we don't know what's wrong. We only know that we're doing what we're required to do by law. We're providing the services, and we're not being paid for them. And so it's got to be fixed. And I'm confident. I'm looking forward to the October 8th oversight meeting, and the one thing I can tell you with no reservation is that everyone is aware that this is a serious problem, and the very best minds that we can possibly find to fix this problem, which don't include mine, but the very best minds are doing everything they can. They're working long hours. Does that mean that we've solved it yet? No. But does that mean that we are working as hard as we can? Yes.
David, do you hear from your constituents about DHHS? Have you heard from people concerned about it?
Yes. We, like I say, and I'm sure the other 169 members of the General Assembly also hear from their constituents back in their respective districts as well. That was one of the things when I first ran for office, and I think it's one of the things that Governor McCrory has said as well. If you're playing by the rules, if you're doing business with the state, or you're relying on the state to do its end of something, you shouldn't have to call a legislator to have them call on your behalf to say, how come this claim hasn't been processed? Mm-hmm. I know Governor McCrory feels that way as well. And each time we call, obviously, we get a good response in terms of, yes, we will get right on this, we'll try to get this resolved. But again, it shouldn't have to be that way. We need to progress to the point that we meet the because we meet the obligations that we've committed to the people that we're going to meet.
Well, it's interesting your idea about separating Medicaid from the rest of DHHS, because there's been one hospital, at least part of the reason they're closing in Eastern North Carolina is the Medicaid side. That's maybe not be the whole story. There have been some other large hospitals that have said they have huge deficits because they haven't had their repayments. And then some reports of doctors' offices and clinics closing because of the lengthy time. I mean, you're a business person, so if it takes 4 or 5 months for you to get reimbursed or paid by one of your clients, it causes a ripple effect with your business. So is that an idea, separating that system out and really focusing on that? Because it has a huge effect on jobs and the economy. Is that something that you might be able to put forward in the future?
It's definitely something that I have been considering for some time and have had conversations with some of my fellow legislators about that. But you're absolutely right. It is a huge burden on hospitals and on individual providers if you are providing a service as you are contracted to do and you're not receiving payment. It's just like any other business. At some point the cash just starts to run out. I'm very active and they do a very good job, my local hospital does, of keeping me informed of where they stand, and they've had some real struggles with the new system to get paid, and fortunately I think those are starting to be worked out. But that really put them in a bind. And again, government's not supposed to work that way. Government, it's kind of like, the old saying, you don't worry about the electricity as long as when you flip a switch, the light comes on. People get used to government performing at a certain level. And to be blunt with you, government has a responsibility to continue to perform at those levels to make sure that we're meeting the obligations that we told people we were going to meet. DHHS itself has been undergoing what a lot of businesses and other organizations have to undergo. It's been struggling to meet its core missions while at the same time trying to reinvent itself, trying to figure out how it can better meet those core missions in the future. I know that the leadership over at DHHS, Dr. Vosh, especially, I know are working very hard. They're doing everything they know how to do to make this work. We all want this to succeed. We all have a vested interest in making sure that this succeeds, and you will see additional focus placed on that in the coming weeks.
All right, let me change gears and talk about education a little bit, because there's a lot of debate going on about, numbers. Was education funded at the same level? But there were also some changes that you made with vouchers or opportunity scholarships and expansion of charter schools. So I want to give you a chance to respond to some of those issues around education.
All right. First of all, just to be clear, as Speaker Tillis says, winning an election doesn't make you an expert on education. So I don't claim to be. But here's what I feel. Here's how I can speak from my heart. Every person I know wants the kids in our schools to have whatever it takes for those kids to learn what they need to learn, to live up to the fullest potential that they have, to be able to compete in this worldwide economy that we have. Every kid deserves the right to learn at least 1 year. Every kid deserves the right to advance 1 year academically for every one school year that goes by. The setting in which that is provided is very important. And we are committed to the public school system, and we appreciate and we admire those that go into traditional public education. We have funded and support that. The bottom line, though, is that the kid is more important than the system. The system is important and it needs some attention. And I think you're going to see when we come back in May a lot of attention paid to trying to make sure that we reward our good classroom teachers. You're going to see looks at some of the policy changes that were made to make sure that they are meeting the objectives that they had. The bottom line, though, is that instead of feeling threatened or upset about the opportunity scholarships or charter schools, I think that everyone would have to agree that the most important thing is that the kid be educated. The environment the kid is educated in is important, but it's less important than the kid. The kid is more important than the system. And most of the frustration that we hear is coming from those who tend to confuse the system with the overall education that the kid is receiving.
But you understand their concern that schools within their communities have a huge effect as to companies that want to locate, companies that want to stay, home prices. I mean, education directly relates to poverty and crime. So I think the concern is those public schools, keeping them as strong as possible. So you can see how the other side would say that taking money away and offering these opportunity scholarships or allowing charter schools to come in, which might draw kids away, could harm those public schools.
In my county, we need more public schools. We don't have enough room for the kids that we have now. I view it as a relief on the traditional public schools if they're if a parent has elected to send their child to be educated in another venue. It should give the public schools the chance to focus and do a better job and reach the population like you're talking about, and have the impact that we all know that that education has. I mean, folks have to know how to live and how to think, and in order to succeed in our society. So we will continue to invest in our traditional public schools, but we will continue to keep our focus on the fact that the important thing is that the kid learns, and again, that every kid learns. Every kid learns. I don't want anything less for any other kid than I want for my kids, and I want the very best for my kids.
Thank you for spending time with us, David. This is Plain Talk Politics. I'm Jeanne Bonds. I've been talking to Representative David Lewis.